Welcome to the University of Michigan Comprehensive Cancer Center. Having a comprehensive status means that we have met the National Cancer Institute's highest standards for clinical care, education, community outreach, and research. This video will help acquaint you with the Cancer Center and what to expect on your first visit to the Melanoma Clinic. In addition, we will give you an overview of melanoma and answer common questions that you and your family members or friends may have. Prior to your visit, you will receive in the mail a Guide for Patients booklet with a map and appointment information. The Cancer Center building is located within the University of Michigan Health System in Ann Arbor. The Cancer Center is easily accessible from major highways and is convenient to Detroit Metropolitan Airport. Covered parking is located within the Cancer Center, and valet parking is also available. Before your first visit to the Melanoma Clinic, you will be contacted by the nursing staff who will provide you with information on your appointment date and time, the clinic location, the cost of the visit, and the availability of support group meetings. Our nursing staff will need to gather important information from you, including a current health history. We may also discuss how to obtain necessary pathology slides and records prior to your first visit. The purpose of this first consultation visit is to educate you and your family, perform the necessary examinations, and develop a treatment plan. The guidelines and treatment recommendations continually change for melanoma as new information is learned. Often, when you have a melanoma, different specialists are needed to develop the best treatment plan. Rather than sending you all over the place to see different people on different days and times, our melanoma specialists meet regularly as a group and will be available as a team to help with your care. If multiple specialists are needed, your care will be discussed at the Multidisciplinary Melanoma Board Conference. When you come to the clinic for your first appointment, you'll be examined by one of our physicians, with particular attention to the entire skin surface and lymph node areas. The most common location for melanoma on men is the back. The most common location for melanoma on women is the back and legs. However, melanoma can occur anywhere on your body, and that is why we examine the entire skin surface. During this initial consultation, we will develop a comprehensive treatment plan that will be explained to you and your family. You may have multiple treatment options. Invasive procedures or surgery are not usually performed on your first visit. We need to explain these procedures to you and schedule an appropriate amount of time. Surgical procedures occur in a different clinical area of the hospital with a specialized surgical team. Each surgery is slightly different and may last in general from 30 minutes to 3 hours. We will explain what type of surgery may be needed during this initial consultation visit. If surgery can be performed in our surgical treatment room, an appointment date will be made and preoperative instructions will be given. If surgery needs to be done in the main operating room, you will usually need a separate preoperative examination to determine the best type of anesthesia. We will do our very best to schedule your preoperative exam and surgery as soon as possible. We will communicate and work with you and your local doctors to provide the most convenient care.